common in Asia. It affects all demographics of all ages. Where does it replicate? It replicates in the tracheobronchial epithelium. Tracheobronchial epithelium. Now, MERS and SARS, they cause a more acute and severe common cold that almost always requires hospitalization, and it's characterized by fever and chills. Fever and chills, which are not seen in the common cold. Not seen in the common cold. Okay. Also, they can have shortness of breath, difficulty breathing with a cough, a non-productive dry cough. Okay. Now, respiratory syncytial virus. This is the leading respiratory infection of infants worldwide. Okay. So how does this one present? In infants and immunocompromised infants, it will cause fever, rhinorrhea, cyanosis, as well as bronchiolitis, which is inflammation of the bronchioles. Children can develop tracheobronchitis, which is inflammation of the trachea and the bronchi. This is what's known as croup, which is a upper respiratory infection characterized by a barking cough. Barking cough. The respiratory syncytial virus is a enveloped single-stranded RNA virus that forms cincta, which are giant multinucleated cells formed from the fusion of infected viral cells in the lungs. Okay, the spread is by contact. By contact. There's no vaccine for this, and hand washing is the most important preventative thing. It's the most important prevention. So it affects children younger than 6 years of age. So, pathogenesis. Why does it cause stridor and increased dyspnea? Because it causes subglottic airway narrowing. Subglottic airway narrowing. Prognosis, most people resolve without complications. Okay? Okay. So now I'm going to talk about the Paramecium viridae family of viruses. Paramecium viridae virus of family. This is a family, okay? And there are 4 viruses in this family that cause human disease, which includes parainfluenza, respiratory syncytial virus, RSV, mumps virus, measles, and metapneumovirus. Okay, so that's not 4, that's actually 5. So that's 5. Okay. So with regards to the Paramecium viridae, think lungs. Think lungs. All of these viruses that belong under this family attach and replicate in the upper respiratory tract. All of them. Okay? Respiratory syncytial virus and parainfluenza, both of them cause lower respiratory tract infections, which is pneumonia. Okay? This is in children, and they both cause upper respiratory tract infections like a bad cold in adults. Okay. Parainfluenza virus causes upper respiratory tract infection in adults and lower respiratory tract infection like pneumonia in children and or elderly population, and also in the immunocompromised patients. The metapneumovirus is actually the most common cause of respiratory disease in children. Now, the virus can disseminate via the blood to distant sites. Okay? Mumps and measles, they both replicate in the upper respiratory tract and they can spread via the blood to distant organs. Where does it go? Well, mumps can go, the mumps virus can go to the parotid gland and it can go to the testes, causing parotitis, which is inflammation of the parotid gland, and orchitis, which is inflammation of the testes. Measles can also cause a severe systemic febrile illness. Both mumps and measles can cause encephalitis, which is brain infection. Now, infection with the hantavirus will cause hantavirus pulmonary syndrome. This is fever, fatigue, and muscle aches, especially in the trunks and the legs, okay? And this can actually become serious where it can lead to difficulty breathing and shock. Difficulty breathing and shock. 50% of diagnosed patients can actually die, okay? Die. This can cause the lungs to fill up with fluid, okay? Transmission is inhalation of dried mouse urine, feces, or saliva, okay? So other viral respiratory infections, they would cause, these, the ones that I'm going to discuss, cause respiratory infections specifically in the children, immunocompromised, and elderly patients. And this includes cytomegalovirus, metapneumovirus, parainfluenza viruses. Okay? Okay, now let's talk about the coronavirus, which is the disease. Again, the name of the disease is called COVID-19. The name of the virus is called SARS-CoV-2, which stands for the SARS and then the CoV, C-O-V, coronavirus, and then 2, okay? So severe acute respiratory syndrome, coronavirus 2. That's the name of the virus that causes the disease known as coronavirus disease 2019. That's why we call it COVID-19, because the first case of the disease was discovered in late December of 2019. This is a RNA virus, as we said. It's an RNA virus. Okay, it's in the same genus, the SARS-CoV-2, the same genus as the virus that causes the SARS and MERS, which is called severe acute respiratory syndrome virus. That's it. Okay, I want you guys to know that the SARS-CoV-2 virus attaches and enters cells by attaching to the receptor called angiotensin converting enzyme 2 receptor. Angiotensin converting 2 enzyme receptor, also abbreviated ACE2 receptor. This receptor lines the